Okay, my name is Jim Howard. I'm a Parent Resource Specialist for Family Network on Disabilities. And I work specifically with the Family Star program to help families with the medical side of disabilities. Family Network on Disabilities, of course, is family-driven, nonprofit 501(c)(3). We do not act as attorneys. We do our best to provide support, provide information, and help families identify their options. So today, as your child turns 18, they are now considered an adult. They'll experience many transitions, including healthcare. It's important that parents have the knowledge to prepare themselves and their young adults for this major change. In this training, we will be looking at how this transition affects the entire family. Once your child is 18, he or she is considered an adult, and they have a right to vote. It's important that the family start to prepare for the transition phase early, and keeping involved preparing your young adult and family is very important. As family, we have the responsibility of making doctor's appointments, wellness checkups, vaccines, insurance policies, co-pays, and many other obligations to make sure our children are healthy. As a parent, it's our responsibility to care for our children. We make and prepare doctor's appointments. We're comfortable with understanding of insurance knowledge, or we know where to turn to. We can understand what our child's disability means and how it affects them. We understand the medications, what they are, and how to give them to our child, and possible side effects. As an adult, our children will now take the responsibilities on for themselves. Are they prepared to make their own doctor's appointments? Are they comfortable with understanding of insurance coverage? Do they understand what the disability means and how it affects them? As an adult, our children will now take on these responsibilities for themselves, and are they ready? If we look at the section on employment, the reality is this is not easy for families or young adults. As a family, you need to give the young adult the opportunity for growth, self-awareness, and independence. It's not easy as a family member to ensure that the young adult is making safe healthcare decisions. One of the most difficult things in transitions is letting go of the young adult. As family, will always be there for our young adults, but it's time to help them make their own decisions and choices. As families, we can help them in making these choices. For me, as a single parent, it's not easy to let go, especially when my son entered college and said, "Mom, I want to do this alone." He was letting me know he was ready to make his own choices, and it was hard to see him struggle with his reading since he was legally blind in his left eye and can only see out of one eye. I'm very proud of him because he finally enrolled in college and was able to graduate with honors. If we look at the chart with the transitional framework, so in getting ready to help our children get ready, we're looking at the preparations stage, helping changing medical care, changing insurance, developing self-help and self-care skills, and educating them on for their education or job planning. And hopefully the outcomes are continuous access to high-quality medical care and a quality of life, functional role, and attainment. Insurance and what my child and family need to know. There's a lot of great resources under the Affordable Care Act. You can Google this if you're not sure, if you don't have access to the slides. And then, of course, Florida's Federal Healthcare Marketplace. Both of these websites have a tremendous amount of information on insurance and connecting in with the Affordable Care Act, and also what that means. One of the things we have to look at is possibly changing medical care. We should start as early as possible, including getting your child to speak with a doctor. You as a parent can help prepare them with a few questions to start. Also speak to them about the fact that as a child, they see a pediatrician, and when they are older, they'll see an adult healthcare provider. Use the example for yourself. You see The child now sees a pediatric doctor because he knows your needs as a child. I see an adult healthcare doctor because he knows what my needs are as a grown-up. So we don't see the same doctor. So some young adults will stay in the pediatric healthcare system a bit longer than the age of 18. Some can stay up to the age of 21, depending on the young adult's healthcare needs, the doctor, and the resources available. I've known many small-town community doctors that work with the kids with disabilities all the way up through their adult life. Also, changing medical care as a family, keep in mind that the doctor is not obligated to give you any medical information once your child turns 18 and they are considered an adult. Make sure that you stay involved with your child's medical decisions, that they sign a medical waiver. At the age of 18, the child is now considered an adult, and under the HIPAA laws, the doctor and medical staff could refuse to give you any information on any medical status or condition. Your young adults can ask the front office or their doctor for a medical waiver. In Florida, a lot of times we call them a release of information, but they must put the family member's name, that they agree to receive medical information about themselves, and the form must be signed and it will be documented in his or her file. Remember that a healthcare surrogate or a medical power of attorney document, if you have this, it's important to make sure the doctor receives a copy of it for the young adult's file. This also applies with the school system. If your child is still in public school whenever they turn 18, the school is not obligated to share information with you unless the child agrees. Changing insurance. As an adult, it's very important to understand the type of health insurance you have, what it covers, how the deductibles are met, and what the copayment amount is. This way you can plan for your health care with success. It's important that the young adult understand and know what insurance carrier they have, the name and ID for the insurance, how much they will need for a copayment for the medical visit, and how much the deductible is. They must meet prior to insurance coverage. It's very important that you discuss the 4 insurance details with the young adult. This helps prepare them with the journey to make their own medical appointments. That way they have a better understanding how things work. So it's important that the young adult know the name of their insurance company, how to call them if they have questions about coverage, and to be able to give the medical staff ID numbers for their insurance. The young adult also needs to understand how much the copayments is for a medical visit and the difference between an in-service network doctor and a doctor or a specialist that's out of network. Keep in mind that also insurance companies do have deductibles per year. It's important to know how the young adult might need to pay out of pocket for a part of that. If we look at independent living, the findings of a growing body of research shows that young adults are taking longer to leave home from mom and dad's house to obtain economic independence and to form families of their own than they did years ago. So what are the goals of some independent living services? Services are provided to maximize the leadership, empowerment, independence, and productivity of individuals with disabilities. The services are intended to lead to the integration of full inclusion of individuals with disabilities into the mainstream American society. There is an agency that helps with this. They're called Center for Independent Living, or CIL for short. So CIL is a consumer enrolled in a nonprofit local organization which provides at least 4 core independent living services. There are 16 separate Center for Independent Living centers in the state of Florida. The 4 core services are information and referral, independent living skills, individual and systems advocacy, peer counseling to persons with significant disabilities. So what this services do the CILs provide? Each CIL provides other independent living services as determined by the needs of the community and availability of resources. You can also find them under the Florida Association of Centers for Independent Living to find somebody in your area. You have to remember that Center for Independent Living is a statewide council established by a federal mandate and Florida statutes. It consists of 15 voting members who are appointed by the governor. Other members are included ex-representatives of Division of Voc Rehab and Blind Services. In compliance with the state law, and a majority of voting members are persons with disabilities. Additional representatives are from the Center for Independent Living, advocacy groups, and other consumer or independent living organizations and various state agencies that are impacted by the Rehabilitation Act. As a family of a young adult with special health care needs and disabilities, we'll always be concerned. We'll always be there for our children. We will always love them and ensure that they have the best meaningful life possible. And if talking about possibly discussing transition and healthcare transition and different things, we have to keep in mind that sometimes our youth are ready for that, and sometimes maybe they're not because of more significant disabilities. Because of their disabilities, we may have to, as a family, we may have to look at other options. But remember, in the state of Florida, that 18 is the magical age. So if your child has some significant disabilities and you're really concerned about his mental or physical functioning abilities, you may want to consult other resources to look at guardianship, some form of guardianship, limited guardianship, depending on your child's abilities. Here's some additional resources throughout the state of Florida. It's going to talk about healthcare.gov, different lists for transition services, Rehab Works, and Florida Center for Independent Living connections. If anybody would like a copy of this handout, please make sure you email me at jim@fndfl.org, and I'll be more than happy to send you a copy of the presentations. We also want to discuss our FND University. This is free for parents. You can go in, log in, and have access to lots of different PowerPoint slide presentations. You can keep track of your learning and also be able to print out transcripts. Once again, I want to thank everybody for joining us today. If you have additional questions, please email me at jim@fndfl.org. This is going to conclude our presentation for today. I want to thank everybody for joining us. Please let us know if we can help you with any of your needs. You can also find us on our main website at Family Network on Disabilities. Thank you so much for what you do, and please let us know how we can help.